information provided in this podcast should not be considered medical advice. We encourage all listeners to consult their healthcare professionals for medical concerns. Thank you. Hi, and welcome to another episode of Ankylosing Spondylitis InfoShare, or simply AS InfoShare as we call it. My name is Enrico Bolanino. In today's episode, I will discuss what I consider the 7 pillars of ankylosing spondylitis treatment. When you think of a pillar, it usually refers to a beam or a giant column that supports and sustains a structure. Like a crucial support beam in a building, without it, the building basically collapses. So when discussing the pillars of ankylosing spondylitis management, each pillar is representing a core area of focus that collectively contributes to the comprehensive care. These pillars, I believe, are vital in maintaining balance and stability in managing the condition, much like how architectural pillars uphold a building structure. These pillars for ankylosing spondylitis, they will be the foundations of our treatment. That is my belief. So let's get into it. The first pillar would be your healthcare team. So the way I think of it is I break it up into 2 circles, the inner circle and the outer circle, or the inner core and the outer core. And the inner core are going to be your main healthcare professionals. For me, that's the primary care physician, because that's the one who's going to be, pretty much taking care of not just your AS, but everything that you go through. And depending on your health insurance, you will need that person to write you up prescriptions and referrals to the specialist that you're going to need in order to help you. So the primary care physician will coordinate your overall health care and monitor everything. And that primary care physician should be somebody you trust, should be somebody you're comfortable talking to, and should be someone who understands AS. Your primary care physician probably doesn't specialize in ankylosing spondylitis, but they should have a good understanding of it so they're not sending you down rabbit holes. They're going to manage your overall health and address non-AS related medical issues, but they should still be able to understand what you're going through. So your next healthcare professional that will be in your inner core or in your inner circle is going to be probably your most important, and that's your rheumatologist, because that's the one who does specialize in autoimmune diseases and inflammatory conditions, and obviously ankylosing spondylitis. And they're the ones who are going to be really overseeing your diagnosis and your treatment plans. They're going to serve as the primary specialist for AS, and they'll be prescribing you your medications, monitoring your disease progress, and they'll coordinate with other specialists as well as your primary care physician. So those are your 2 main, and then the other healthcare professional would be your physical therapist. This is going to be the one who develops and guides your exercise program and help you maintain flexibility and posture. They're going to teach you exercises to improve your spinal mobility, help you reduce pain, and enhance overall physical function. Those would be your 3 main healthcare professionals in your inner core. Then you start with your outer core, and that's going to be different for everybody, I think. But for the most part, I think everybody should kind of at least check in with some of these. One, I believe, would be an orthopedic doctor, especially someone who specializes in spine and the pelvic area. In case the disease progresses within you, eventually you might have to see an orthopedic doctor. And it's good to just, at least early on, I felt that it was good early on just to kind of check in, just so they get to know me. I mean, I'm not at a stage where it's too bad yet, but I felt like if I get them to know me, understand what I'm going through, I try to do like a yearly check-in just to visit. I have decent insurance, so it doesn't hurt me to do that. It's going to depend on your insurance, how often you go. But I just felt it was worth going and checking in with an orthopedic who was a spine specialist and understood ankylosing spondylitis. The other one would be an ophthalmologist. And again, that's going to depend on how your disease progressed. But again, I wanted to check in with one just in case, because AS could lead to uveitis. So I wanted somebody who, just to check in, make sure things were okay, and somebody to get to know me so that just in case something happens, they can help monitor and treat any eye conditions that might be associated with AS. They'll conduct regular eye exams and manage inflammation to prevent vision complications. Another doctor that I had in my outer core was my gastroenterologist. So they'll address any gastrointestinal issues, including those related to inflammatory bowel disease, which is another possibility of progression of ankylosing spondylitis. So they would diagnose and treat any IBD symptoms that may coexist with ankylosing spondylitis. A lot of people say that ankylosing spondylitis is related to gut issues. That could be the case. So again, a good reason to see a good gastro doctor, get them on your team in case anything develops, or you may be at a point where it did develop into something and you need to see one. A dermatologist, and their role would be to treat skin conditions like psoriasis, which can be associated with ankylosing spondylitis, and they'll help manage skin flare-ups and advise on skincare routines. Other medical professionals you may want to see are maybe psychologists or psychiatrists or counselors to help support mental health, addressing issues like depression and anxiety. They can help provide therapy, coping strategies, and, if it gets to a certain point, any medication management. Another good healthcare professional to have in your corner is a nutritionist or a dietitian. Their role would be to offer dietary advice to support overall health and manage ankylosing spondylitis symptoms. They'll help create meal plans to reduce inflammation and help you maintain a healthy weight. And of course, your pharmacist, and that's going to vary. Sometimes that's overlooked, but one of the things that I've come across with dealing with medication prescriptions, some pharmacies don't always carry what you need. So you want somebody, you want an established place that's going to get you the medication that you need and have them in stock, be able to provide any information on side effects and, proper administration techniques if needed. So that's the first pillar, your healthcare team. You want to put that together. Like I said, your inner core of doctors and then your outer core, depending on how your disease progresses and what you want to do. So the second pillar would be your medication. And, some people try to avoid medication, and I get it. They don't trust it, but sometimes it's really needed. Some can do without, some can't, but you should listen to your doctors and think about it to make sure that you take your medication regularly, you don't miss any doses, and, you have what you need. And usually the first line of treatment for ankylosing spondylitis are NSAIDs, or non-steroidal anti-inflammatory drugs. So those are typically the initial treatment choices for AS. They help reduce inflammation, relieve pain, and improve any stiffness complications. Common NSAIDs include ibuprofen, like Advil, Motrin, and naproxen, like Aleve. While these are effective, long-term NSAID use can lead to gastrointestinal issues, cardiovascular risk, and kidney problems. I personally try to avoid them. I try not to take them daily. I usually might take them during flare-ups, but again, that's going to be up to you and, discussing it with your primary care and your rheumatologist. The second set of medications are biologic disease-modifying antiarrhythmic drugs like DMARDs. If you find NSAIDs are insufficient, biological DMARDs may be prescribed. These medications target specific components of the immune system to control inflammation. So you have things like TNF inhibitors, which block protein involved in systematic inflammation. So these are like Humira, Enbrel, Remicade, and those type of drugs. These are usually administered via injection and can effectively reduce AS symptoms. I take Remicade, and that's an infusion for me, not an injection. I used to take Enbrel. I changed to Remicade only because it was getting difficult for me to get the Enbrel from my pharmacist. So the Remicade was a little bit easier. It wasn't every week, so I had to go every 6 weeks to get an infusion. Other types of medications are IL-17 inhibitors. These target another inflammatory pathway. There's Cosinex, Taltz, Bimzelx. probably butchering these, but those are the type of medications that you might be prescribed. Then there's also JAK inhibitors or oral medications that interfere with inflammatory signaling pathways. Rinvoq would be an example of a JAK inhibitor. They offer an alternative for patients who prefer oral medications over injections. So just important considerations: there's an infection risk with biological DMARDs, and JAK inhibitors can suppress the immune system, increasing the risk of infections. So regular monitoring is essential. Before starting any biological treatments, they usually screen for tuberculosis and hepatitis B. The side effects, they vary by the medication, and you should always be discussing those with your doctors. So it's crucial to work closely with a rheumatologist to determine the most appropriate medication regimen based on individual health status, disease severity, and response to the treatment. So that's pretty much what I consider my second pillar is medication. So the first, like we said, is our healthcare team. The second is medications. The third is, for me, physical therapy and exercise. A physical therapist experienced in AS can design a personalized exercise program tailored to your needs. Key components of such a program often include posture training, flexibility exercises, strength training, aerobic conditioning, balance and breathing exercises. These type of things is what a physical therapist, which again is part of your pillar number one. Pillar number three is putting what therapist gives you into action. Physical therapy, exercises, incorporating specific exercises into your routine, which help manage AS symptoms. So things like a press-up stretch, where you lie on your back and gently press up on your elbows to stretch the lower back, wall sits, planks, standing leg raises. The type of exercises you do will depend on your condition and what you're able to do, and that's why a good physical therapist can kind of guide you through it. But some are able to do all kinds of exercises and keep it all in check. Others are find challenges. But basically, you want to do some engaging, low-impact aerobic activities, which can be helpful. Things like swimming, walking, if you can, cycling, yoga, and Tai Chi will help promote flexibility and balance. Either way, consult your healthcare professional. It's always recommended to start slowly and work your way up. And of course, listen to your body. If an exercise is causing you pain or discomfort, obviously stop and consult your therapist. And the main thing, and this is my biggest problem that I have, is consistency. You have to be consistent daily, bi-daily, whatever it is. You have to do it. You have to do the exercises. And I'm guilty as anyone else of slacking off, and I feel it when I slack off and I don't do my exercises, I don't do my stretches. I definitely feel tighter, stiffer, a little bit more pain. And when I do my exercises, especially my stretching, I definitely feel better. And I try to include a little strength training in that as well, nothing too crazy. Again, and that's going to depend on your personal situation. You might be able to do some heavy lifting. That's great. Others may not. So anything that you can do based on what your healthcare team is telling you, it's good to incorporate exercises and activities into a daily routine because they can significantly impact your ability to manage your AS and do it effectively. We do post on our social media pages some exercises that you might be able to do. Obviously, you check in with your healthcare professional, but we do have some posted on our Facebook page, Instagram, Twitter, and YouTube. So that's our third pillar. So just to review, regular physical activity is essential for maintaining mobility and function. Stretching exercises, which improve flexibility and reduce stiffness. Strength training, which is going to support joint stability. Aerobic activities, which will help enhance your cardiovascular health. And posture training, which prevents spinal deformities. And, low impact exercises such as swimming or Tai Chi, which are going to be gentle on the joints. So now we'll go to the fourth pillar, which is diet and nutrition. An anti-inflammatory diet can help manage symptoms. And if you go online, you're going to see a lot of people pushing different diets for AS. Some push the low-carb diet, some push an all protein diet, all meat diet, carnivore diet. There's so many people telling you different foods to eat and different things to do, and they might contradict each other. So again, you want to talk to either a nutritionist or your doctor, or sometimes you just want to listen to your body and see what's causing you discomfort and what helps. But basically an anti-inflammatory diet will help manage symptoms. The anti-inflammatory diet will emphasize fruits, vegetables, whole grains, lean proteins, and healthy fats. And they'll tell you to limit processed foods, refined sugars, and saturated fats, which is basically the fundamentals of any healthy diet. An anti-inflammatory diet will also tell you to increase omega-3 fatty acids, which are found in fish and flax seeds. They may reduce inflammation. Calcium and vitamin D to support bone health. But again, you might just want to listen to your doctors and see what they say. I can only just tell you personally what I feel. I do avoid starches. I definitely feel when I eat processed foods and starches and breads and that I feel kind of beat up the next day. I'm trying to avoid gluten. I don't think there's any solid proof on these things, but again, I'm just listening to my own body, and that's what I've come to see, and that's what you got to do, is basically just listen to your own body based on what you eat, see what works for you, what doesn't work. And again, it's not going to happen immediately. For me, it's usually within 24 hours. I'll feel something. I'll feel sluggish, maybe after a day or two of eating something bad. Anything with high salt in it, I'll try to avoid as well. So that leads us to our fifth pillar, which I believe is sleep hygiene. Quality sleep is vital for overall health and symptom management. I try my best to have a consistent sleep schedule, which helps regulate the body's internal clock. I'll try to create a comfortable sleep environment. I have a nice firm mattress that I like, and I have a good pillow. I like white noise, so I put in some white noise. I have a little machine that sits on my bedside. I also got myself one of those eye masks to help keep out the light, and I found that helps. I got a real thick one. It's kind of a heavy one, so it really stays in place and it really blocks everything out, and I think it works. I also got myself a weighted blanket, and I love it. I definitely feel like it helps me sleep better, and I tend to sleep with a fan on. I don't know if that's good or bad, but I just feel that slight breeze. I have a ceiling fan. I put it on low, and I just like the breeze while I sleep, and that might not be for everyone, but those are the things that I try to do that help me. It might be different for you. And another one of those things that you might want to do is if you have sleep apnea, that might fall under your medical professionals, is to get a doctor to help with sleep apnea if you have it, to get tested. If you need the CPAP machine, I had it at one point. I was not crazy about it. I felt it was uncomfortable, but the doctors are telling me to get it because I do have sleep apnea, and I think I should, because outside of just giving you a good night's sleep, it's supposed to be good on your heart. A good sleep is good for your heart, so I'm gonna try to go get another one and use it again. So other things that you can do is do some relaxation techniques, such as reading or gentle stretching before bed might help. They say to stay away from blue light and stay away from things like your iPhone and your computer screen and watching TV. I know some people like to watch TV before they go to bed or get on their iPhone and kind of decompress, but they do say that it's not good for your sleep night. They also say to limit stimulants, like avoid caffeine before you go to bed. So that's the fifth pillar. Our sixth pillar would be mental health support. And again, we discussed earlier that you might want to have a psychiatrist or a psychologist or a counselor or something, but it's good to have somebody to help addressing any psychological issues. Addressing psychological well-being is crucial, so you might want to consider counseling or therapy, which will help provide strategies to cope with chronic illness. Maybe you want to join a support group. You can find plenty of those even online for ankylosing spondylitis, which might be helpful, and they'll offer shared experiences and encouragement, which is good. Also include things like mindful practices such as meditation, which can reduce stress, and just overall stress management. Techniques like deep breathing or yoga can alleviate tension. And the seventh pillar our final pillar would just be lifestyle and self-care strategies. So incorporating healthy habits into our daily life to help support overall health management. Things like quitting smoking if you do, because smoking can increase problems with ankylosing spondylitis and the symptoms that come with it. Limit alcohol. Excessive intake may interfere with medications. And for me, like I said about starches earlier, if I have alcohol, I'm going to feel it the next day or two. So I stop drinking altogether, maybe a glass of wine every now and then, but I try to avoid any alcohol intake. You want to maintain a healthy weight, which will help reduce stress on the joints. You might want to do things to help optimize your work and home environment to reduce any strain. And going back to pillar number 1, you want to make sure you do your regular medical checkups, constantly monitor your disease progression, and adjust treatments as needed. So those are your 7 pillars. Number 1 is your healthcare team. Number 2 is your medication. Number 3 is physical therapy and exercises. Number 4 is your diet and nutrition. Number 5 is sleep hygiene. Number 6 is mental health support. And number 7 is your lifestyle and self-care strategies. So that's it for today's episode. I hope this helped. Again, these are just things that I do, and I just wanted to kind of pass that on to you, and hopefully it helps. And hopefully it's something that you do consistently, because that's like my biggest problem. Like when I say like the diet and nutrition, yes, I do snack occasionally and I regret it, not just because of the weight, but because of what it's going to do to my inflammation. I feel like if I eat the wrong foods, I'm going to feel it. And when I eat the right foods, I feel better. When I do my stretching, I feel better. When I take my medication regularly, I feel better. So those are the things I've noticed. You've probably noticed them too. Hopefully this podcast will motivate you to be more consistent, and hopefully it'll motivate myself as well to be more consistent. So thanks for listening. Be strong, AS Warriors, and remember to check us out. The podcast is on various podcast platforms such as Apple, Spotify, and it's on YouTube. We have a whole bunch of other videos on YouTube, helpful videos. We are on Facebook, Instagram, and X, formerly known as Twitter. So please, if you can, subscribe to all of those channels, stay up to date with us. And, if you like what you're hearing, like what you're seeing, please make comments. Please let us know. Please give us feedback. And please, 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 like I said, subscribe to our channels and help us grow, and share. And please help share the things that you like on social media. Thank you so much, and see you soon. Bye-bye.